I'm Bruno de Oliveira, originally from Brazil, although I've been living in the UK for the last 15 years. I started as an undergrad and then went to do my master's, PhD. So today, I'm a lecturer in social psychology slash community psychology. So I look at the social economics of mental distress. What's the impact of poverty on people? What's the impact of being homeless on an individual, on a group of people? As a psychologist, I like to use a plurality of methods. So you normally are going to be aware of the numbers and the words, so quantitative, qualitative, but I would like to use visual research methods. So I like to use photography on ways of exploring a phenomena, exploring experiences. So what that does is allow us more participation within research. So we call that participatory research. So we allow participants to collaborate in collating photos, in collating exhibitions, and on disseminating the experiences to the community. So my research on homelessness and the impact of perhaps austerity is try to provide a very robust narrative through images. That project's called Unframed Lives. So that project has won award, has been recommended by the education minister. What we do using visual methods in psychology in a participatory way is that many stakeholders are contributing a dialogue. So we're learning from each other. So that shows the impact of psychology research, not just on individuals, not just in communities, but far wider. Coming to Solent, you are going to learn a plurality of methods, methodologies, exciting approach to psychology. So you're going to see that psychology is not something cold, detached. It's a reality that we experience through our practice. So you're going to be looking how to use art, ways of working with different communities and groups, using art therapy, using visual research methods to map community engagement. So within the team, we have people who've been published at the United Nations, have people who won awards nationally from the Department of Education. So it's a very robust team when it comes to psychology, when it comes to social psychology, when it comes to work with communities. What you're going to gain from that is the experience of active researchers on the ground doing research in a very exciting, different ways.
So my name is Dr. Teresa Corbett and I am a lecturer in psychology at Solent. I specialise in an area of psychology called health psychology, where we look at how psychology can help us to understand why people engage in certain health behaviours, such as smoking or physical activity, and also how we can help people to manage chronic illnesses. An example of some of the work that I've done focuses on how we can enable older adults to have more effective conversations with healthcare professionals. So a lot of the time when older adults have multiple health conditions, it can be really difficult for them to manage all the work they have in relation to managing their health. Because of that, we wanted to develop some sort of a way to support older adults to have an opportunity to discuss their healthcare, but also to discuss their values and priorities. And the idea was that this would help them, but it would also help their healthcare providers to know and understand what life was like for them. We use research to help us identify the kind of different issues that older adults face. We used evidence and psychological theories to help us to understand the problem in more detail so that we could come up with the solution. And we developed a structured conversation tool called the Chat and Plan, based on strategies that we know from psychology research that are known to change behavior. And we tested the tool using lots of different methods, interviewing people and talking to people and finding out whether they thought it was useful. And what we found was that people liked it and felt it could be really useful in practice and could be something that would be really beneficial to change healthcare practice. So at the moment, cancer nurses are currently using the tool here in Wessex, so across GP practices, and we are evaluating how useful the tool is and if it helps people to improve their quality of life and if it helps healthcare professionals to improve their practice. So it's being used with people who have completed treatment for cancer. If you were a student at Solent, we might look at this intervention and break it down and think in detail about the different components that are being used in the intervention and think about why different components or different behavior change strategies are being used. You would learn about the different theories that have informed the development of an intervention like this, and you would think about why people develop certain attitudes or why people engage in certain behaviors and focus on why something like this might be an issue and why we might want to try change it in this way. So because we have done this research and we have been putting all of the different things that we know about psychology into practice, it can be really useful for you to learn about our research while you're undertaking your degree at Solent. It makes things come to life when we can use examples of the practice that we've done and the changes that we've made through our research.